Do you have questions about your estrogen lab tests? Maybe you're having estrogen-like symptoms, feeling hot. Maybe you're feeling a little more sensitive, or maybe you're having none of these and your estrogen levels show high on the blood, but you don't really have these symptoms. My name is Dr. Taranella, and in this video, I hope to give you a more complete understanding of estrogen lab testing. We're going to look at the different types of estradiol testing, the different types of estrogen testing, and how to get a real accurate read on your estrogen levels through a blood test. As I said, my name's Dr. Taranella, and this, like all my videos, are made to help you go beyond basic health. And this video should do that with regard to lab testing and estrogen, but it's not tailored to your specific health needs. So please read this disclaimer before we jump into the video topic. So in this video, we want to give you a more complete understanding of estrogen through lab testing and understand where your estrogen levels might be. Understanding the different ways to test for estrogen, you'll get a better understanding of why sometimes symptoms are not necessarily going to match what your lab results show. The first thing to understand is with the duration between the time that you're testing and the time that you have applied the hormone. For instance, if you're doing a testosterone injection and you're wondering if your estrogen levels are high, it really depends when you're going to check the blood to see whether or not those levels are high. If, for instance, you check your estrogen levels 7 days after the injection, it's probably not going to be very high at all, although it may still be high, but you're not really going to be capturing the peak of that estrogen level. Typically, the peak of the estrogen is going to follow the peak of the testosterone, but it's not going to be too far behind the testosterone. So if the peak testosterone is on day 2, 3, maybe 4 after your injection, then the estrogen is going to be on day 3, 4, maybe 5. Now, this is specifically for testosterone cypionate, and most people that are doing testosterone replacement therapy are taking testosterone cypionate. The other types of testosterone replacement therapy, like enanthate and propionate, are going to have similar duration, but the main point is that you want to be checking shortly after, maybe a day after, when you expect the peak of that testosterone is. Now, in the case of a more topical application of testosterone, and for females, if they're applying actual estrogen, the same ideas would apply. That is, when you apply the topical hormone, you want to be checking it when it's at its peak, or at least not when it's at its trough. Now, for topical applications, it's typically going to be 2 to 12 hours after you have applied that. If you check the levels 24 hours after you apply it, say you put it on in the morning every day and you go in for your lab the following morning and you haven't applied it yet, the levels are typically going to be back to below or at where they started before you started using that hormone replacement therapy. And that's because it's had time to work itself out of your body. Our bodies are detoxifying these hormones or getting rid of these hormones as they're coming in. So we have to be cognizant of that when we're checking our blood. Now, everyone's ability and efficiency at detoxifying or removing these hormones are slightly different. So that's why sometimes you have the same dose in 2 different people and the levels may be higher or lower in that person. So along the same lines, a lot of people ask, I'm having estrogen or high estrogen-like symptoms. For males, they might be having like hot flashes or nipple sensitivity or fatigue, etc. And they're wondering why their actual test results show low or normal. So the first thing to understand is the interval between when you're applying it and when you're actually testing your blood. The other thing to understand about estrogen lab testing is the actual tests that are being used. The main contributor to estrogen-like symptoms is estradiol. So this is the best test to be looking at when you're trying to understand your estrogen levels, but there are actually 2 separate but similar types of estrogen tests. The one is done by mass spec liquid chromatography, abbreviated MSLC, and the other is done through a different, but through a less accurate testing methodology, which is referred to as ELISA. It's more of a antibody-based testing. The MSLC estradiol testing is looking directly at how many estradiol molecules are in the sample. So it's a very specific and sensitive type of test. The other test that's done through ELISA is just called plain estradiol or serum estradiol. The MSLC estradiol test is also sometimes referred to as ultrasensitive estradiol or just sensitive estradiol. And Based on those names, you can kind of guess which one is more accurate at picking up the actual estradiol molecule. The plain estradiol test done through the ELISA method or immunoassay is prone to false positives and possibly some false negatives too. But basically what's happening there is anything that's estrogen-like in nature or similar in structure to the estradiol may trigger an actual result that is an actual estradiol. And that's where you're going to get false positive results or higher results than one would expect. Now, you may say to yourself, well, if there's similar molecules to estradiol, those are going to stimulate the estrogen receptor in the same way that estradiol would. That's a really good question and one I can't really answer in absolute terms, but more than likely the things that are giving the false positive result or triggering it to be more elevated than what the ultrasensitive estradiol says are things like estrone and estriol. These are other types of estrogen known as E1 and E3. Now remember, estradiol is the most biologically active, and so if you are getting triggered by E1 and E3, that is an estrogen, but it's not something that's going to stimulate the estrogen receptor in the same way and with as much vigor as the E2 or estradiol molecule will. It's also possible that if you eat a lot of phytoestrogens, it may trigger this test as well. But I really don't think that's of much concern. And I don't think the E3 and E1 are as much concern as the actual estradiol molecule. Still, if you want to get a more broader understanding of your total estrogen level, there's also something known as total estrogens, which will check all the molecules that are estrogenic in the sample. I think that along with the ultrasensitive estradiol test will give you a good understanding of what's going on in your body in terms of estrogen. Match that with your symptoms and you'll have a better understanding. Now, we often talk about, in terms of testosterone, free or bioavailable testosterone, meaning the amount that can bind to the receptor at any given point in time. That's known as the free testosterone. So why not free estrogen or free estradiol? Well, the bioavailability of estradiol and testosterone is going to be determined by the lack of sex hormone binding globulin and the lack of albumin at any given point in time. The more of those you have in your body, the lower your free or bioavailable estradiol or testosterone will be. So if you're having ongoing estrogen-like symptoms, it may be worth checking or measuring the free estradiol levels too, which is a test that's available. In practice, though, this usually is not done, and that's because the level of estradiol determines the levels of sex hormone binding globulin, so that if one is high, the other would be as well, thus predetermining what the free estradiol would be, or at least giving you an approximation of whether or not you have a problem with bioavailable versus bound estradiol. Still, it's worth noting because someone did have a question on this, and also because there's always exceptions to the rule. All right, so that's all I had on lab testing for estrogen. Hopefully this gives you a more complete understanding of estrogen through lab testing.